My name is Cheryl Brandt, and I'm a nurse educator. I'm a professor in the College of Nursing and Health Sciences at UW Eau Claire. I have to master not just one profession, I need to master two: nursing, education, because I'm a nursing educator. And the skills that you have as a nurse are not the same as the skills that you have as an educator.
I was delighted when I asked Cheryl if she would be willing to be the nurse educator to be filmed for this documentary.
The knowledge of my discipline in nursing changes over at an incredibly fast pace, and the skills and strategies in the education world are also changing at a fast pace, and I have to keep up. And so I'm taking continuing education courses as a nurse, but I'm doing continuing education professional development as an educator to make sure that I know what are the tools and strategies that I can pull into the classroom or pull into the clinical setting that reflect best practice, current best practice.
I think what you're going to see, you'll find to be exceptional, but I need to tell you, it is not the exception. It is the norm for our nursing faculty.
So this semester, I have had teaching assignments in 6 courses. 4 of them are undergraduate and 2 of them are graduate.
For each 1 credit that a student has for theory, that's about equivalent to 1 hour of class time. In comparison, in clinical, it's a 1-to-3 ratio. So you have 1 credit, but it's 3 hours of clinical. So if a faculty member has a 3-credit clinical that they're teaching, we're talking about 136 hours over the course of the semester that they're actually doing clinical time.
I share lecture responsibilities in a 3-credit graduate course. I represent Mayo Clinic Health Systems on some committees at the Mayo Enterprise level. And then I've had a couple hours of research team meeting with one of my faculty colleagues and our undergraduate research assistant. In the afternoon, I have attended University Liberal Education Committee meetings because I'm the college rep to the university committee. And then along about 3:30, I'm getting in my car and going over to Mayo because I have to read patient records and identify the patients that my students are going to be taking care of for Tuesday morning clinicals. On Tuesday morning, I get up early because that's my clinical morning with my second semester junior students. And so I leave the house a little before 5 o'clock. I head to Mayo, and I'm heading to a medical surgical unit there where I am with my 8 or 9 students. I've sent them their assignments the evening before, and I have updated information on the patients that I share with the students and kind of review and point out, okay, this is something you're going to have to do.
So when I get here, it's about 5:45, and I meet Cheryl in the nurse's station, and then she gives me a pills, which is just kind of like a breakdown of what my patient's life is like and what's going on. And then her and I will discuss anything that we don't understand or anything that maybe needs to be clear.
And then I'm out the door, or just on the floor and pounding the pavement, so to speak, moving from student to student, patient to patient. I have a metaphor for clinical instruction, which is the metaphor of an air traffic controller. And I have 8, 9 student-patient dyads, and they all have to be kept in the air. And nobody crashes, nobody burns.
So whenever I have any questions about my patients or medications or anything like that, I ask her, and then she kind of just watches over me, makes sure I remember all the things that a senior nurse would remember. So she just is kind of my little guardian angel, I guess.
And anybody who knows med-surg nursing knows it's a constant state of flux, and you're dealing with a lot of different patients. You're kind of the jack of all trades when it comes to nursing. And so trying to help students negotiate those sort of experiences can be very intense. There's many times in the course of your shift or your time there with the students, there's no time to eat. There's no time to drink. There's no time to use the restroom because you're literally going from one thing to the next.
There has been a great shift in that sage on the stage to transitioning to active learning.
I'm using more and more student small group activities and actual experiential things, care planning, case studies, and so I have had to learn a new skill set.
The amount of preparation that goes into being a good instructor is just so time consuming. We might have lecture for 2 hours, but it would be absolutely nothing for me to spend 20 hours preparing for that 2 hours.
I've had to find time out of the usual Monday through Friday workday times like Saturdays or Sunday afternoons to create digital content, things like voice over PowerPoint or Camtasia built videos. Does it pay off? I think so. Students appreciate the digital content. We get positive comments in our course evals, but it's been a new thing.
Everybody's overextended. The workload is intense. And then there's also advising. Because once again, we want to be there for the students, and the students' needs come first.
The expectation in the early 80s for faculty availability to students was pretty much confined to when are your office hours. We're still expected to keep office hours, but there's this thing called email.
It's actually kind of convenient to communicate with Cheryl. I just email her. We have her number, so if we need to call her, text her, anything like that.
Am I available to students on Saturday and Sunday? Maybe not technically, but then when I'm at home working and I have my Outlook open and an email comes in from the student, I'm going to answer it. You know, on the one hand, you could say, no, pretty hard-nosed about it, I'm off the grid. But I'm not off the grid because I'm home grading papers anyway. One of the things that UW-Eau Claire prides itself on is the level of availability of faculty-student collaborative research. And so that expectation means that we as faculty need to find time in our schedules to work with our students. And so I've needed to carve out upwards of 4 or 5 hours a week, some weeks. And so that has been, I guess I would say, on the one hand, a wonderful and engaging and just kind of almost exhilarating experience, but it takes more time.
I would love to be able to say that the footage of Cheryl Brandt, who has been videoed for this documentary, was really somebody who is acting the role of faculty on steroids. But the reality is, she is what nurse educators are, very multifaceted, multitasking individuals who are striving to stay at the top of their game in their nursing specialization and in their role as nurse educator.